And now let's bring in ABC News political director Rick Klein. Certainly an ambitious plan that was just outlined there by President-elect Biden. He said it will not come cheaply, but we cannot afford not to do it. What stood out to you, Rick, and how realistic is it for this proposal to move forward in the new Congress?
This is a staggering array of program changes, subsidies, legal changes, longtime priorities of progressives, many of them tailored and enhanced for the COVID age. The price tag of some $2 trillion, of course, stands out, given the divided politics that we're in. But the calculation here from President-elect Biden is that he needs to go big to try to establish very early on in this presidency that there is a Biden coalition and that it can rally, in his words, with some unity around the magnitude of the challenge. Very critical of the way that COVID-19 vaccine has been rolled out, trying to marshal some degree of unity in a time where people are just so divided. You can't imagine a more divisive atmosphere in the country and in the Congress than the one that is confronting Joe Biden. Yes, the Democrats control Congress, but they are very, very narrow majorities, and it is going to take everything that Joe Biden can muster to try to get packages like this through the House and especially the Senate.
And this plan comes under the specter of a looming impeachment trial in the Senate in the first days of the Biden administration. How much could that complicate the legislative calendar and for getting bipartisan support for this plan?
Yeah, think about it, Lindsay. The opening days of the Biden presidency are going to be consumed with an impeachment trial. We are going to see that in the Senate. The Senate's going to have to focus at least some of its time on that, as opposed to confirming appointments and, of course, considering this proposal. And we have this atmosphere of tension on Capitol Hill, as we've reported. Members of Congress are, some of them, fearful that other members of Congress may be out to harm them. Those are very serious allegations. No one can even guarantee really the safety of the inauguration itself. But you hear from President-elect Biden his desire to address a joint session of Congress next month. That's the first time he's outlined that plan to talk about what he calls his Build Back Better program. And again, try to get some political momentum early on to try to cut through where this is. And I'll tell you this, the Biden team has long said that whatever the noise of Donald Trump, and there's been a lot of it, especially lately, the American people recognize what the challenge that Joe Biden confronts really means. And COVID-19, getting the economy back, maybe beyond that, trying to confront the nation's divisions, they think they can get some unity out of a shared commitment to defeating coronavirus once and for all.
ABC News political director Rick Klein, thanks so much, Rick. And Biden just laid out, as you heard, a bold $1.9 trillion COVID relief plan, with most households getting an additional $1,400, enhanced unemployment benefits of $400 a week, and other measures. We'll see if this can get through Congress. And to help us unpack this plan, we bring in ABC's economic correspondent, Deirdre Bolton. Deirdre, thanks so much for joining us. Walk us through what Biden's plan would mean for the average American and those who are now out of work.
Lindsay, what it really means is it is a necessary lifeline. If we look at those numbers of Americans who are out of work, more than 18 million people are receiving some form of unemployment insurance. Even if you look at today's numbers, the initial weekly jobless claims, it was the worst number that we have seen since August. Two economists told me that the number was absolutely shocking. So there are a lot of people who need help. If the President-elect Biden's plan is passed, there would be support for workers, for businesses, for families. And of course, keep in mind, what we spend collectively is 2/3 of our economic activity. So in addition to people having obvious stresses from not having a job, if you don't have a job, you don't spend. From an economic standpoint, that holds our growth back, Lindsay.
And Deirdre, the U.S. deficit hit a record-breaking $573 billion in the first 3 months of the budget year. That's more than 60% higher than where it was a year ago. And this deficit doesn't even reflect the $900 billion of new stimulus that's already passed. So what does the exploding deficit mean for our economy?
It's not great. It's not fabulous. There's nobody who would tell you that that's different than being somewhat concerning, if you like, meaning we are spending more than we are bringing in. However, the counterpoint to that is, if you look at the last recession, when we're coming out of 2007, 2009, there were some mistakes made where stimulus was pulled back by many people's argument and by many people's observations too early. That made our recovery longer. So I think it's quite quite clear that it is too soon to take away any kind of stimulus. We heard from the Fed Chairman Jay Powell speaking today in a question and answer session at Princeton and essentially saying it's just too early to take away any kind of stimulus. So most people that I've been speaking with use this analogy. I think it's pretty good, Lindsay. It's to say if you're outside of your home, you see it burning down. You're obviously concerned about that, but you're not going to worry about the water damage that's coming from the firefighters who are trying to put the fire out. That's where we stand right now from a fiscal standpoint, Lindsay.
Good analogy, really puts it in perspective for us. Deirdre Bolton, thanks so much. And let's now bring in ABC News contributor and infectious disease epidemiologist, Dr. John Brownstein. Doctor, exactly a month ago today, the first COVID vaccine was administered. According to the CDC, about 11 million shots have since been distributed. You just heard President-elect Biden say that they have a goal of 100 million shots in their first 100 days. Is it realistically possible to achieve this? And should we be prepared to be in some long lines all around the country like we have seen in places like Florida?
Yeah, thanks, Lindsay. I mean, this Biden plan of 100 million doses, 100 days is definitely lofty. It's quite an operational challenge to embark on. It's one of the biggest challenges we've ever seen. It is possible, and if we get it done, then we will get this pandemic under control. The proposal so far is light on specifics, but I think we can get to that 100 million number. That is about improving the existing infrastructure, adding in vaccination sites, really ramping that up, expanding access to the vaccine based on age and pre-existing conditions, adding, improvements to the federal supply chain. Of course, we also need willing arms, right? We need better messaging and communication. So hopefully the funding will go to better education around the vaccine. We can't get into some of the same debacles we've gone into with testing. Clearly, 100 million would get us half the way there to herd immunity, which is about 200 million people. So of course, that's exciting, but the logistical challenges are going to be extreme. Right now, you can't go to the web and fully understand your eligibility or book appointments. Will the Biden plan really get into some of those and help remove these long lines? We don't want these vaccination sites to be also super spreading sites. So a lot of challenges and obstacles, and hopefully some of this effort will help to resolve that.
And when it comes to the vaccine, you've been saying that the problem isn't about manufacturing and shipping, but the need to expand access. So do you feel that the $20 billion proposal towards a national vaccination program just proposed by President-elect Biden will help alleviate some of that? Is that enough?
Yeah, I think at least we're finally putting real money to work to alleviate some of these challenges. As we know, it doesn't help to have vaccines in warehouses. It's all about this last mile problem, right? So how do we improve access, community vaccination centers, improve access for hard to reach populations, expanding access through pharmacies, but also large mass immunization sites, right? Large arenas and fields where we can get to large numbers of people. But of course, the states themselves have to still work out their kinks. It's not just a federal problem. They have to work to identify populations, build out networks of providers. And so there's a lot of effort being placed on the states. And actually what's amazing to see about the Biden plan is there's expansion of public health workforce, 100,000 new individuals being brought in to support states. If that happens, I actually think we can really make a big dent on this pandemic.
Dr. Brownstein, that's what we like to hear, that there could be a dent coming up soon. So we appreciate that optimism and your outlook. Thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.